Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today my topic of discussion is about a case of Thygesons Superficial Punctate Keratopathy. Thygesons Superficial Punctate Keratopathy are basically multiple grayish-white intraepithelial lesions, opacities, superficial located, and they are not involving the conjunctiva, and they are usually present in the central area. Even they don't go into the periphery. Their genetic, if we talk about association, it is considered to be related to HLA-DR3. This is a case presented to us in emergency, and patient complaining of pain, redness, photophobia, discomfort, irritation. And you can see in this photograph that there are multiple opacities, multiple lesions which are distributed evenly throughout the cornea and mostly in the central and mid-peripheral area, and the conjunctiva is not inflamed. This is another anterior segment photograph. Here, the same patient who has undergone some treatment, which I will discuss later on. He has developed some staining over there. You can see it is taking fluorescein stain and giving green appearance under cobalt blue filter light, and it is towards improvement. This is another photograph, same patient, stains over there, discrete, in different areas being involved, but the density of these lesions has decreased now by taking the stain. Another from a different angle showing you the staining pattern and how evenly different areas which are involved by these. These are superficial opacities which centrally get stained with fluorescein and give this appearance. But the conjunctiva is quiet throughout this disease. As I mentioned earlier, the patient presents with water, photophobia, foreign body sensations, and to some extent occasionally pain. But mainly his complaint is irritation and discomfort. Pain is not very specific for this type of condition. So what happens that in early stages there are some discrete areas of patches or flecks, you can say, which gradually increase in size. Once they increase, they formed vertical lesions over there, vertically oval lesion with irregular margins. And with the passage of time, this central part of these vertical oval lesions fall off. And this is the area which gets stained with fluorescein. As I mentioned, that the center of the lesions falls off and it stains. So this whole disease time period has been assessed, and it can persist from some minutes to it can persist for different hours, we can say. But later on these lesions shrink and they disappear. So total period, we can say this disease can take from 12 hours to days to weeks. So it has some variation in its duration. If we divide this disease in two stages, we can call one stage is active and the other is inactive stage. During active stage, you can say 15 to 20 lesions occupying the central or mid-peripheral area and with oval in location, and discrete elevated lesions are formed over there. And these are because once these lesions are formed, the corneal surface remains no more smooth, and it develops irregularity. This is the cause of the photophobia and discomfort, irritation. And because of this, during this stage, if you put fluorescein, it will stain. But if you put rose bengal, it will not stain. Now we talk about the inactive stage. During inactive stage, these elevated lesions start flattening, and they appear grayish stellate shaped appearance, subepithelial opacities, and usually they fade away, but sometimes they persist. And if you stain at this inactive stage, when the lesions have flattened and attained the grayish appearance, the fluorescein staining will not be that much positive. In fact, it will be negative at this inactive stage. So corneal sensitivity in these patients is decreased, but it never finishes or absent, we will not say, as it occurs in the herpes disease. Secondly, if we talk about the treatment, mainstay of treatment is, of course, the corticosteroid eye drops, which are given to these patients, and once the disease gets under control, they are tapered off. And apart from this, tacrolimus 0.03% 12 hourly can be given, and later on they can be tapered off to once daily. And even cyclosporine eye drops 2%, and in some cases 0.1% have been proven very beneficial. But the thing is, the patient has severe pain, discomfort, and this irritation, I mean. So that can be relieved, this discomfort, by using the bandaged soft contact lenses. And meanwhile, the drug will start having its effect. Along with this, frequent lubricant eye drops should all be prescribed to these patients. So this is a disease I discussed, but it's also very important to differentiate it from other common entities like this. For example, superficial punctate epithelial keratitis. Superficial punctate epithelial keratitis usually presents as small grayish-white opacities with or without surrounding infiltrates. While if we talk about the filamentary keratopathy, these lesions will be there, but they will have a mucous core surrounded by epithelium. And that epithelium which is surrounding, which will be of variable length, and one end of it will be attached. So while differentiating, these are two entities which are very common, which may mimic as the Thygesons Superficial Keratopathy. For literature review, I will recommend you to please go through these articles. These are very interesting articles, particularly that one published in 2021, Thygesons Superficial Punctate Keratopathy, a review and a case series, published 2021 by Dr. Smruti Rekha, and the other articles I have mentioned. I want to thank my respected audience for their attendance and attention. Thank you.